The biggest tips I have for patients, suffering with adult acne would be just to simplify things. When you go on social media, you're going to be inundated with numerous products. Most people are trying to sell you something to make money. So simplifying things with a gentle acne cleanser, you can use that in your routine morning and night. Also with other things like topical retinoids. So there are prescription retinoids, and there are also ones that you can buy over the counter like adapalene. So incorporating that into your daily routine is really important. And then sunscreen. So a big thing that we see a lot with acne is acne scarring. So we really want to prevent that down-term effect of acne, those scars that are more permanent. So if we use sunscreen, we can really minimize that scarring and really protect your skin. So really keeping things simple. So like I said, a gentle cleanser, retinoid products, and also sunscreen, I would think, is what I would recommend for just your basic kind of, acne routine. And then if that's not working, definitely come see us and we can kind of expand on it from there. When we're thinking of topical retinoids, you can think of retinol. That's your kind of really mainstay of over-the-counter vitamin A derivative treatments. Those are typically used more for wrinkle treatment and aging, things along those lines. For acne, you can think of adapalene. That is really for acne, but that's really the only one that you can get over the counter. Once you see a provider, they can then supply you with something called tretinoin, and these all work in very similar mechanisms to help promote normal and healthy turnover of the skin cells and really help, treat existing acne and prevent new acne from coming up. So they're all targeting the same pathway, they just have various levels of efficacy. The big thing in the morning, so if you're going to wash your face, a lot of people like to wash their face whether or not they're showering or just kind of freshening up in the morning, and then patting your skin dry. And then you can apply moisturizer and definitely a sunscreen. So you really need to protect your skin in the morning, particularly if you are using any of those retinoid products, because they can dry the skin out. So definitely face wash, moisturizer, and sunscreen. Sometimes you can combine the sunscreen and moisturizer together. I like those products. They're just more simple, so people, it's easier to adhere to that. And then at night, you can, wash your face again. Again, if you're using gentle cleansers, I think morning and night washing is okay. And then you'll want to use a moisturizer, and that's when you would apply your product like a tretinoin or, a retinol product at nighttime, typically before bed. And again, moisturize, because some of these acne treatments really do dry out the skin. So we want to be really on top of the moisturization and the sunscreen. And I think another key is don't give up. Acne treatments take time. So we're looking at on the order of 2 to 3 months before we start to see noticeable differences. So oftentimes patients will do it for a few weeks and then stop, but we really wanted to keep at it, as routinely as you can, because if you give up too early, then you don't see any effect. So at least giving it that time to work is key.